So good morning, afternoon, evening to everyone. My name is Petra Nachmias. I'm Chief of the Population and Social Statistics section here at ESCAP Statistics Division. And it's my pleasure to welcome you to this ESCAP Stats Café session, which is the second in our series of Stats Cafés on completing the questionnaire of the 2025 Review of Progress in implementing the Regional Action Framework on CRVS in Asia and the Pacific. So the questionnaire we're focusing on today serves as a key instrument in assessing how far we've come in achieving our shared goals on CRVS and identifying areas where further efforts are needed. So your input and experiences are vital in ensuring that this review is thorough and reflective of the diverse challenges and successes across our region. So we're very pleased to have representatives from the Maldives and the Philippines with us today, and they will share their country's experience in completing the questionnaire. Their insights will be invaluable for all of us as we work to ensure accurate and comprehensive reporting. I'd like to also take this opportunity to recognise the work of both these countries in improving their CRVS systems and the close collaboration we've had with them, as well as their valuable assistance in providing feedback on the questionnaire. We really do appreciate their efforts and all the support they've given us. We're also pleased to have colleagues from ESCAP who will guide us through the technical aspects of the questionnaire, offering their expertise to help us navigate any challenges along the way. So we've got a lot to discuss and not too much time. So without further ado, I will hand over to our moderator, Roth.
Thank you, Petra, and thank you, everyone, for joining. As Petra mentioned, this is a very important initiative that we're undertaking. It's to ensure that we have a good idea of where we're at in terms of implementing the Regional Action Framework, which, of course, all of you know is very important for achieving our regional commitment as well. So let me just share my screen. And we're glad that colleagues from the Philippines and Maldives are able to share their experience in completing the questionnaire. So that's, very valuable, and I think, much more, in a way, much more interesting than what I'm presenting in a certain sense. So I'll try to keep my presentation short so that we can have more time for our colleagues to share their experience. So as you all know, back in 2014, we established the decade, and the goal of the decade is to make sure that we achieve universal and responsive CRVS systems. And the goal of the review essentially is to make sure that we achieve the goals and targets that we set at the start of the decade. And it's not the first review we're doing as well. We've done 2 reviews already, the baseline back in 2015 and the midterm back in 2019 as well. So this is the 2025 regional review to make sure that we captured all the progress throughout the decade. So in more detail, why are we taking the review? Well, as mentioned previously, is to monitor progress throughout the decade, but also it provides the basis for decision-making at the Third Ministerial Conference, as well as you all know, 2024 is the end date for the decade, but we already had discussion, and the regional steering group have recommended that we are extending the decade to align with the 2030 agenda. We are extending the date from the review, but will provide a basis for that as well. It will also, based on experience, it will also provide key insights into the design of development projects by development partners. It's really helpful to help them shape their support to countries. And finally, the review will make sure that we have a very good basis on what we have achieved to date and what we need to do further to achieve the 2030 agenda. So what does the 2025 review looks like? It's essentially we're conducting it in the form of a questionnaire where we've sent the countries for their inputs, and they have to return it to us by the 15th of September. Some of the key information that we're asking for relates to universal registration, of course, legal documentation, and timely production and dissemination of vital statistics. And these are not new; these are essentially the goals and targets that's under the regional action framework. Once we've gotten the country reports and country questionnaires, we're analyzing it and validating the data to produce a regional review report, which will serve, as mentioned previously, the basis for decision making at the ministerial conference. These are the areas in the questionnaire itself. We have guidance, definitions, and the key main tab that we have in the questionnaire is a birth registration, death registration, and so on. I thought maybe it's helpful to actually show you instead of just mentioning this. So I'll share my screen again. And this is an example of the questionnaire that we've sent to countries. And we've tried our best to pre-fill the questionnaire to help facilitate the completion process. So data that countries send over to us for the baseline and the midterm review, we've pre-filled where possible, the data in the relevant tab. And of course, we've updated the international database, the international data from international database that we use as well. So, on the first tab here, you'll see the name of the national focal point if the country has assigned one, and then some context, guidance, frequently used definitions, and you can see here, these are the main tabs that we've pre-filled. Country are asked to enter the data in the yellow tab, and we pre-fill the data here under specific years based on the data that they provided to us. And these are the type of variable that we're asking it in the form of a questionnaire where data. And then we'll have the target here where we've set up some formulas that will help countries in computing the variables as well. Same with death registration and cause of death, as well as vital statistics. Again, we're asking country to fill the yellow cells here. We have the same for implementation stuff. We've actually cut down on some of the questions, streamline it, so that it's easier for countries to complete the questionnaire. And we have a new tab called Action Area, which is key to identify some of the more qualitative progress throughout the decade. And some of the questions here will form the relates to university on the key themes. Of course, decided to include not only in the review but also in the extension as well, and that's on resilience and inclusivity, as Tanya will present to you a bit more later on as well. So just getting back to sorry, let me just stop sharing my screen a bit. Getting back to the presentation a little bit. Right. So how should the questionnaire be completed? Well, if countries have already assigned a national focal point, that's fantastic, and the national focal point should be the main center that's under the facilitate discussions and data collection from relevant ministries, potentially using the national CRVS coordination mechanism. And of course, development partners have raised their hand and then mentioned that they're able to provide support where possible. Once we've gone, ESCAP can be the central coordinator for that. So if you have any questions or require any additional support, you can either reach out to the development partner directly or reach out to ESCAP, and we'll be able to help in any way we can. And we also recommend hosting a multi agency or interministerial or small national meeting to allow representatives to come together and provide data and validate data as well. We have some support available as listed here. We have a frequently asked questions and answer list where we have it on our website. And we have today an online Q&A session. We had one previously on the 14th of August where you can find the recording as well. And the recording for this Stats Cafe will be up after the meeting, so you can share with colleagues who are working on the questionnaire or are interested as well. We've done a series of workshop and sort of sub-regional meetings. Again, the information are also on our getinthepicture.org website, and partners will offer support to National Focal Point in completing the questionnaire. I've talked to a couple who have already identified that they have already been supporting countries as well. Just a little bit on the Q&A, the list of frequently asked questions and answers. So just some of the questions. These are some of the questions that we've gotten from countries. For example, they're asking, whether they would be filling just the 2024 data only, or they should fill previous years as well. These are some very good questions, of course. So if you have similar questions, more than welcome to reach out to us. And just to answer that question, we would like countries to fill out all of the cells, all the yellow cells, including data from previous years as well, not just 2014. For example, should the data table here refers to birth, death, and cause of death registration? Should the variable for table 1-2 cover the period from August 2023 to July 2024? These are good questions again, and you can find more detailed answer in the list of frequently asked question, which I can show you right now, actually. So if you go to our getinthepicture.org website, you'll see that and if you search for the 2025 review, you'll come to our main page where you can get all the information on the review. And then you click on Q&A, you'll get to the list of Q&A that I just mentioned, and then you can find you can try to see if some of the questions that you have might have already been answered. So yeah, let me just get back to the presentation. Right. So yeah, just a final slide from me, and that's just an update on where we're at in terms of our work on the review. We're now in September. That means we're just a few weeks away, actually just 2 weeks away from countries submitting their questionnaires to us. And once that's completed, we'll look at the questionnaire, we'll follow up with countries to validate the data that they submitted, and then we'll start working on the draft regional review report. And then by January, we'll aim to have a first draft ready for comments. And then March, we'll submit the final version for editorial and translation, which will be in time for submission and presentation at the third ministerial conference on the 24th, from the 24th to the 26th of June, 2025. So that's a lot longer than I anticipated. But, again, if any of you have questions, or if you would like more clarity on any of the process, please feel free to put it in the chat or raise your hand. Due to the sake of time, we'll go through all the questions after the presentation. So please put those questions in the chat at the moment, and then we'll get to them after the presentation. Right. So that's all from me. Next, we have information sharing by our colleagues from the Philippines. Let me just share her slide. Ms. Majori Wilava, sorry if I mispronounce your name. She's going to share the Philippines PSA's experience in completing the questionnaire for the 2025 review. So it's interesting, and we're thankful for the Philippines to be able to come and share with us their experience, because not only have they finalizing their questionnaire, they also participated in the pilot of the questionnaire, at a very early stage, so they have very vast experience to share here as well. So without further ado, Marjorie, the floor is yours.
Okay, thank you, Rob. Good afternoon. I'll be sharing the Philippine experience in completing the questionnaire for the 2025 review of the Regional Action Framework on Civil Registration and Vital Statistics. The next slide presents the content of the presentation. I will present an overview of the process of completing the questionnaire, identifying and engaging with stakeholders, handling and
possible the data,
filling out the questionnaire, challenges encountered and solutions, and lastly, feedback on completing the questionnaire. Now for the overview, we have the timeline for completing the questionnaire. We anticipate that the finished questionnaire
in the relevant tab. And
this includes time for data preparation and stakeholder consultations. Additionally, we will allocate time for review and approval to ensure everything is in order. The steps required to complete the questionnaire are first, distribute the questionnaire to the relevant agencies. Second, prepare and review the data requirements. Third, complete and review the questionnaire. Fourth, consult with stakeholders for their input. Fifth, finalize the questionnaire based on the feedback. This is the stage that we are. Last, obtain approval before the official endorsement to ESCAP. We now go over the approval process and the expected time frame. Before presenting the questionnaire to stakeholders, the PSA preferred to expedite the collection of their input. Then the questionnaire was shared with stakeholders who were asked to provide their comments and feedback within a month. Given the varying schedules of the stakeholders and the time needed to prepare data requirements, finalizing the questionnaire may take up to 2 months. This timeline ensures that we accommodate all necessary revisions and approvals. The next slide, now with identifying and communicating with stakeholders, the PSA engaged the Interagency Committee on Civil Registration and Vital Statistics, or the IAC CRVS, in the process and spearheaded the completion of the questionnaire. We used several methods to communicate with stakeholders and gather their input. The questionnaire was introduced at one of the regular meetings of the IAC CRVS, and additional feedback was collected through email. The questionnaire was also distributed via Google Docs to facilitate easy access and completion. These methods ensured comprehensive engagement and efficient collection of stakeholder input. The key steps and duties involved in processing and validating data before finalizing the questionnaire include data collections, data cleaning, and data preparation. We gathered birth and death data from the database, ensuring that late registrations and delayed submissions were included. Duplicate records were removed, ensuring its accuracy. Then we prepared the data and generated the necessary information, which were then presented to the IAC CRVS for review. These steps ensure that the data used in the questionnaire is both accurate and comprehensive. Here are some challenges that we faced in obtaining the specific data. The birth registration data is substantial and contains a significant number of duplicate entries, which complicates the validation process. Additionally, this data, which includes late registrations beyond the cutoff date for inclusion in the statistical reports, is not available for public release. Second, the birth registration data for under 5s and adults from the CRVS database are not yet validated. Therefore, we used census data as a reliable alternative. For death registration data, validation of the underlying cause of death was not performed for cases registered late or beyond the official release cut-off period in previous years. As a result, we relied on data from the official release for these instances, which has a cut-off date of registration a few months after the reference year. Here are the main challenges that we faced. The processing for registrations that occurred beyond the cutoff period for inclusion in statistical reports only began with the 2015 data. Consequently, previous submissions for the questionnaire relied on official releases, as I mentioned before, which had a defined cutoff period for data inclusion. Comprehensive data on birth registrations for all individuals, including those under 5, as detailed in Table 1, line numbers 6 and 7 of the questionnaire, is not yet available from the CRVS database. For causes of death data, one challenge is the variations in definitions. There are differences in the concept or definition of ill-defined causes across different sources. For instance, the ICD-10 manual has a list in the annex. Then it also indicates that all R codes are ill-defined. While the Anaconda software, which we use to evaluate the data, also has a different list. However, we have now adopted the list outlined in the ICD-10 manual as our definitive reference for reporting. The questionnaire also referenced ICD standards, which we understood to mean that there should be no ill-defined codes. However, we interpreted this to imply that causes of death should be coded strictly according to ICD-10 rules. Another one was variation in concepts across submissions from different years, affecting the consistency of the data. But we have already addressed this by standardizing the data according to a uniform concept across all relevant years. Some additional challenges we faced were different interpretations of concepts based on individual understanding. Meeting the time frame to complete the questionnaire was a significant challenge. And lastly, compiling and providing the necessary references and supporting documents for the action areas added complexity to the process. To address the challenges we encountered, we took the following steps. We collected and processed additional data to meet all required specifications. We included detailed notes and comments in the questionnaire to clarify and support the information we provided. Then we formed a team to brainstorm solutions and compile the necessary documents. And lastly, we solicited inputs from the IEC CRVS. To resolve similar challenges in the future, we recommend establishing a team to facilitate the completion of the questionnaire, just like what we did, and then conduct a workshop to prepare a draft version of the questionnaire to help streamline the process and ensure that all necessary information is gathered efficiently. And then bring together all relevant stakeholders for a workshop to review the pre-filled questionnaire. This collaborative review will allow for the provision of additional information and ensure that the questionnaire is comprehensive and accurate. As for the feedback on completing the questionnaire, the additional information provided on key concepts such as the standard assessments,
In country to
voluntary national reviews, and ill-defined codes greatly improve the clarity of the definitions and make the questions more comprehensible. Additionally, the clarification of skip instructions has made them easier to follow, further enhancing the overall usability of the questionnaire. Last, to ensure the successful completion of the questionnaire, support is needed on providing a briefing on the process for completing the questionnaire to ensure all participants understand the requirements and expectations, and engaging stakeholders and partners by presenting the questionnaire at a meeting or a forum. conduct a workshop to facilitate quicker completion and expedite the collection of essential inputs. These measures will help streamline the process and gather the necessary information efficiently. So that concludes my presentation. Thank you for your attention and have a great day.
Thank you so much, Marjorie. It's very good to see the progress made since the new tab called Action Area, which is the informations that we've gotten from the regional steering group was super helpful in PSA's work on completing the ill-defined codes and the ICD-10 as well, because that was a key point of discussions during the meeting, and I'm glad that it helped. Just some one key takeaway from me from the presentation is that it's important to convene workshop or meetings to bring everyone together and validate the information, because it seems not only it helped with PSA at the at the national level, but also it helps that we have regional or sub-regional meetings to help with the completion of the questionnaire as well. So thank you once again, Marjorie. It's very nice to have you and your presentation. So now we move on to our next presentation, and that's by Ms. Fatima Riaza. Let me get the slide up quite quickly. There you go. Riaza, can you hear me?
Yes. Can you hear me?
Yeah, we can hear you. I hope this is the right slide.
Yes.
Okay.
Thank you. So let me share our journey to completing the midterm review questionnaire as well. Next slide. So my presentation basically covers how we took about identifying and communicating the stakeholders at how we would like to continue completing the questionnaire, the process we took in, we carried out for validating the data as well as sending out the questionnaire to different agencies, the challenges that we have encountered and the solutions that we have proposed from our side. The kind of support that we provided line ministries in filling up the questionnaire, as well as the timeline of activities that we are proposing to complete to have the questionnaire submitted by the given deadline. Next slide. So when we received the questionnaire from ESCAP, what we did was we reached out to Ministry of Health, as it involves a lot of information coming from Ministry of Health, and we proposed Health to work with us as a lead partner in filling up the midterm review questionnaire. So we took time to review the questionnaire from both the agencies, and there were certain doubts that we had initially, for which we reached out to ESCAP and had a separate online meeting with the ESCAP, the CRVS team, to go through the questionnaire with us, and we are very grateful to ESCAP for that. Next slide. So after that, what we did was we sort of identified the stakeholders for whom we are going to send the midterm review questionnaire. Again, in consultation with Ministry of Health. So we have the National Statistics, CRVS Technical Committee in place, and we thought that would be the best avenue for us to go about filling up the midterm review questionnaire. And from the technical committee, we sort of identified the key agencies who would actually be involved in the process, and we did reach out to them. So the key agencies that we identified was Department of National Registration, for whom the sections on birth and other relevant section was important. The local government authority, similar section. Ministry of Health had as we identified, they had to fill all the necessary sections in the questionnaire. City Council more on the last two section, and the MBS we as lead agencies, we sort of help with the other agencies to fill the relevant section. Slide. So once we identified the key stakeholders, what we did was from the NBS side, we sent out official in letter to all the relevant agencies, requesting all the agencies to complete the questionnaire. And in the same letter, we did invite all the agencies to an introductory session where we went through the questionnaire with all the relevant authorities, which we did on 25th July. And during the meeting, we all the agencies kind of agreed that they would share the responses by 15th August. And we, in reference to this, the meeting, we also communicated this deadline to all the agencies as well. But unfortunately, by the given deadline, we were able to receive a response from only one agency. So what we did was we did follow up with all the agencies and we monitored their progress and provided assistance during from July to August till the end of August as well. Next slide. So in terms of filling up the questionnaire and validating the information, what we proposed from our side was to DNR and LGA, we gave them two options. One is to share the microdata with us and we sort of do all the necessary computation, or the agencies, they complete the responses with the data. So to facilitate this, what we did from our side was we created a template for microdata and we shared it with both DNR and LGA. DNR was kind enough to share all the necessary microdata with us to complete the questionnaire, and we have sort of completed it as such. So by now, as we are at the beginning of September, we have received all the responses from all the line ministries, and we are right now in the process of validating all the answers, and we are meeting with relevant agencies to clear their doubts and trying to understand the given responses they have included in the questionnaire as well. Next slide. So the challenges that we encountered when, especially the line ministries encountered when filling up the questionnaires was the legal aspects. So we have a current act in place since 2022. However, we do not have the following regulation in place at the moment. So certain things are being done in the country according to the previous regulation. So there is a bit of confusion here and there on the legal aspect as to what we should be reporting and what is being done and from which should we report in the midterm review questionnaire. In terms of data retrieval, we have got the responses from different agencies, which we have to again revert back to the agencies and validate the results which we have got. Just like Philippines Authority has mentioned, we are right now in the process of doing that and trying to identify the right data and as well as identifying the duplicates coming from various data sources. And so we're trying to figure it out and hoping that we make it before the given deadline. So what we noticed during the whole process,
And
it is important that we start with this process as soon as possible, and coordination with the all agencies throughout the process is also important, because what some may perceive is not relevant to them, at the end of the day what we see is it's also relevant to those agencies. So the missing areas in the questionnaire, we are again reverting back to the agencies, saying to them that this is something that you could in fact fill from their side as well. Next slide. So in terms of support, we have provided to these agencies is for DNR. We have assisted them in computing the microdata needed for the questionnaire in terms of that's for the registered number of births in the country as well as for the total deaths. LGA has shared us this information, and we are right now doing the validation together with the information we have got from DNR. Ministry of Health reached out to us to provide support in validating some of the past responses which has been included in the questionnaire, because they right now have a new team in place. So some of them are completely new to some of the sections included in the report. So we are trying to go through the past responses with them, as well as trying to help them recall the recent activities we have done with different line ministries as well. And in terms of coming up with the future priorities for the country, we are working together with Ministry of Health, DNR, and City Council as well. Next slide. So our road ahead in terms of activities, we have planned ahead till the submission date. Well, we have passed the deadline of submission for the responses from the stakeholders. Even though initially we proposed to do it by 15th August, we didn't get only one agency replied. But by the end of August, we were able to get responses from all the agencies. We are still in the process of validating the responses, since we got the response from different line ministries just few days back. We are carrying out validation meeting with the stakeholders during this week, and in fact, we just had today the first of these meetings. Our plan is, as we move forward, once we have all the responses verified and validated with all the line ministries, our plan is to present it to the policy makers in these agencies, and if time permits, we are planning to do it and trying to submit it by the given deadline of 15 September, and hoping to make it by then. So that's it from our side. Thank you.
Thank you so much, Riyaza. It's great to have you share your experience as well. Just to echo what Riyaza mentioned, Maldives was very proactive in reaching out to ESCAP for a meeting to just clarify some key points, and then that's what we found to be quite helpful. And also, I would encourage other countries who are completing the questionnaire, if you have any doubts or uncertainty, you more than welcome to reach out to us, and we can set up a meeting to clarify that as well. I just love this slide I'm putting on at the moment. It's fantastic. I mean, it's just very good. It's good to also see that you're meeting with stakeholders and potentially presenting to policymaker. I think that's key, because it's as mentioned, the data from the findings from the review will be shared at the ministerial conference, right? So involving them early on is a good way to prepare for that. And that's a good segue into the next presentation from Tanya, who's our CRVS lead here at ESCAP, who is going to talk to us about preparation for the ministerial conference. Let me just share my screen, and I'll pass the floor over to Tanya.
Thank you so much, Roth. And I mean, it's hard to get after these amazing presentations. And a huge thank you to both Riyaza and Marjorie for doing these. We really appreciate it. I also know that you have a typhoon in the Philippines, and I know that Riyaza had to move things around in order to do this. So really huge thanks to both of you. And I think there's so many lessons from the way that you've conducted these reviews for other countries to learn. So we really appreciate it. I mean, all of your work on the review, and also that you're willing to share with others. So I'm just going to talk just a few minutes about what we're going to use this review for, which is to be presented at the ministerial conference, the third ministerial conference on CRVS, which will be held in June 2025. And basically, we will be, can you go one back, Roth? You're very fast. Basically, back in 2014, countries in Asia-Pacific declared the Asia-Pacific CRVS decade, which is coming to an end this year. And here's the birth certificate of the decade. And also the region agreed to these 3 goals and 15 targets. And the review that Roth and our colleagues from Maldives and Philippines have been focusing on so far today is really reviewing how far countries have come in this. And then we'll bring everyone together for the third ministerial conference in June. And now you can move on, Ruth. Thank you. So why are we holding another ministerial conference? We had one in 2014 where everyone agreed on the CRVS decade and the goals and targets. And then we had one in 2020, which then became 2021 because of COVID, where we were assessing how far countries had come through the first half of the decade. We're now at the end of the decade, and we really need to celebrate some very significant achievements. Philippines and Maldives are definitely some of the countries that have lots to celebrate, but also many other countries in our region have made really significant and impressive achievements. So we need to celebrate this. We need to show that, you know, when we get together and we agree on something, we can actually move towards those goals. But of course, we're not yet there. So we also need to identify which other kind of areas of support are needed in order for all countries to get to the universal registration we agreed to back in 2014. So this is a second kind of point for the conference. As I mentioned, we're not really there yet, and our regional steering group has actually for 2 years now recommended that we extend the CRVS decade to align with the 2030 agenda. So assuming that the countries in the region agree with that, that should be one of the outcomes of the ministerial conference to formally extend the CRVS decade to align with the 2030 agenda, giving countries a few more years to achieve universal registration, as well as the other goals under the regional action framework. So what we expect is a ministerial declaration on CRVS in the region. We expect to extend the CRVS decade, as I just mentioned, and then also based on recommendations from the regional steering group, we are hoping to get some more specific language on how to ensure inclusive as well as resilient CRVS systems. And actually, I saw that our colleague from Bangladesh had put some excellent comments in the chat box around their work on improving CRVS, and I saw that there was some mentioned there of disaster response and so on. And I think this issue of resilience is only becoming more important. So we will try and have some discussions around those two areas, inclusivity and resilience as well. So a few more logistical and practical things. The ministerial conference will be in person at the UN Conference Center in Bangkok. So please put it in your calendars. Most of you would have to travel for that. The official event will be 24th to the 26th of June. And we are super lucky that we have quite a large number of development partners that have agreed to co-organize this conference together with ESCAP. I'm not going to say the whole list because it's very long, as you can see here.
Very good questions, of course. So if you
that are very active in CRVS in various countries in the region, and we're very, very proud that the organization of the conference will really reflect that complexity and that dedication by our partners as well. One question we're getting from countries a bit is who should we send? And we will send the formal invitations to the Ministries of Foreign Affairs in your countries. And then it is a government decision who should attend.
Just to answer that question, we would like countries.
Ideally, see delegations with different stakeholders represented. I mean, if we can get a couple of heads of government, that would be amazing. But we would like to see ministers of interior, health, planning, the other kind of ministries that are responsible for civil registration and statistics and health in your particular setting. And then, of course, also high-level government officials from these different areas of work. We can't be super prescriptive of who you should send. It really depends on your national setup and who are most relevant. But we would very much like to see multiple ministries represented from all of the countries attending, really to reflect on the multisectoral aspects of CRVS. Of course, we are also expecting our partner organizations and co-organizers, as well as NGOs and civil. And we will invite the media to cover the event. We are expecting something between 300 or 400 people. Who knows? We don't know yet. But similar conferences in the past. If we get more than that, that's fine as well. The room is fairly big. So let's see where we end up. And a little bit more, if you could go to the next slide, Rob. So what do we plan to do that week? Well, not just that week. We're actually starting with a forum for children, youth, and civil society, which will happen in March. And we're super excited to be working together with some excellent partners to be facilitating some consultations with these groups beforehand, as well as the actual forum in March. I think it is really important that we hear from these people what are the actual impacts of not being registered and how can they also support registration at the community level. Then on the Monday, so before the formal ministerial conference, we will have some sub-regional as well as sectoral forums. And then we have the formal senior official segments on the 24th and 25th of June, and the ministerial segment on the 26th of June. And we will have lots of time for statements from countries where you can highlight the fantastic progress you've made, and also where you're still working on things and what else needs to be done. And then we will have on the side of all of this, we will have an exhibition space. There will be lots of side events, probably some receptions and other stuff still to be decided. And on the Friday, we will have a conference of donors, which may also be an argument to send some of your high-level colleagues, as these donors should be present there during that week as well as all of our development partners. So that's it. I could talk about this for hours and hours, but this is not the important thing right now. The important thing is that we get all these questionnaires done for the review. And I'm sure you all have a lot of questions for Roth, who's leading this and doing an amazing job, and also our colleagues from the Philippines and Maldives on how they progressed on this so far. So over to you. Thank you.
Thank you so much, Tanya, for the very insightful presentation. As you can see, it is very relevant. The two key tasks, preparing for the ministerial conference and the review as well, because it's essentially not only helping the ESCAP Secretariat, picture.org website conference is also helping countries in your you'll see that reach out to high level management to prepare them for their eventual participation in the ministerial conference as well. So I think it's good that we have our colleagues here from the Maldives and the Philippines. So please make the most out of this opportunity and raise your hand or put in the chat box your questions to them and to us as well. If you have any on the questionnaire, completion of the questionnaire for the 2025 review, it's important in a way that you do reach out to us if you have any concern or any question, and we'll be happy to help you all with that. So I'm just going through the chat to see if I missed any question earlier. And again, as Tanya mentioned, thank you to colleague from Bangladesh for sharing, very detailed, comprehensive, insights on not only the challenges, but the possible solution and the implication of those solutions on the development aspect in Bangladesh as well with regards to improving CRVS. Okay, it seems like I have not missed any question previously, so that's good. Well, I have a hand up from Tanya.
Thank you, Roth. Since no one else has put a question up so far, I will repeat one of the questions I'm getting more and more from countries, which is, we have been working really hard on this, but
you can try to see if some of the questions that you
submit by the 15th of September. What do we do?
Yeah, that's a very good question, and we have an answer to that on the frequently asked question. Let me just quickly show that on screen. just to also highlight the other questions that are there as well, in case you have some, and you might want to consult this first. Let me just. As you can see, it's very comprehensive, and this question covering all aspects of the questionnaire completion, including who should be responsible, what data is needed, and how or if any endorsement is needed for completion of the questionnaire. So of course, as Tanya mentioned earlier, we've been getting questions from countries as well. We set the deadline so that we have enough time to go through the questionnaires and validate any data, as well as making sure that the data are consistent. So when we are doing the analysis, and just to note that the analysis here, we're not trying to compare countries to one another or anything like that. Is essentially for countries to look at their progress as well since the start of the decade. So the data here would essentially be for that, just for them to look at their own progress. So that's important to mention. So if countries cannot make the deadline for whatever reason, please contact us as soon as possible, so we can both work together and see what is the best way forward. We of course would suggest that countries reach out to us directly so we can see what are the individual circumstances that countries are facing, so that we can work together on a solution. Ideally, we will want to have the questionnaire submitted as soon as possible, because we also have to work on the analysis, and that takes time. And of course, we at certain point we need to have a cutoff point so that we have all the data that's needed to analyze the data at a regional level. So that's important to know. But thank you, Tanya, for mentioning that question. All right. Is there any other question? We can also see here as well. So for example, for colleagues who, using Russian as your working language, you're welcome to submit that in Russian as well, as it is one of the official UN language. And of course, this is one of the things that I wanted to highlight as well. We welcome any qualitative information. Actually, we encourage country to enter in the comment and note cell in their questionnaires to us, and ones that might not be captured in the quantitative data aspect of things. So please feel free to share that. We will use that as as part of our assessment and preparation for the ministerial conference and the review report as well. So please do include that where possible. So yeah, you're more than welcome. You are encouraged to go through the list of Q&A if you have any question, and see if you can find some answers already. But again, we encourage you to reach out if you still have concern and questions to the ESCAP Secretariat. Since we don't have any more question for the time being, I think let me just take this opportunity to thank our speaker again. Thank you to Majori, to Riaza for their time and kind sharing of their experience, to colleagues in this room. I'm sure everyone find it very helpful, and we will have recording of this session up on our website, so you can share that with your colleagues who are working on the questionnaire or who are interested. in the 2025 review. And the review report, once it's available, will be up on our website as well, the getinthepicture.org website. So please watch that space. Review report. And do allow me to close this meeting, and thank you everyone for your active participation. I hope this was very helpful Stats Cafe, and we'll be posting a lot more information on the review as well as the conference preparation on our website. So please follow that, and we hope you find something useful over there. That's all from me. Thank you everyone for your participation, and hope to see you again in the next Stats Cafe or other webinars. Take care.